How can I treat lines around my mouth?
There are three common types of lines around the mouth area that occur with facial aging that patients in our practice often express concern about. 1. Vertical lip lines or wrinkles above the lips. 2. Nasolabial folds, also called parentheses lines, that appear at the outer part of the mouth and taper into the nose area. And 3. Mesolabial folds, which become more visible on the outer lower corners of the mouth, often referred to as marionette lines. These lines and folds are due to tissue changes associated with facial aging, such as a decrease in facial volume from loss of bone, fat, and soft tissue, as well as a reduction in skin thickness and quality. I'll talk about how I help my patients with these lines around the mouth in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping my patients with changes seen with facial aging is a core focus in my practice, with particular emphasis on the lips and the area around the mouth, referred to as the perioral area. Vertical lip lines is a term which refers generally to lines which appear above the upper lip. These lines result from several contributing causes. This means that each cause should be approached to get the most effective outcome. Deep lines that appear when the lips are puckered are caused by the activity of a muscle called the orbicularis oris muscle. The appearance of these deep creases can be improved by strategically reducing muscle activity using a neurotoxin like Botox. As the activity of the muscle decreases, the depth of the creases improve. With consistent use of a neurotoxin over time, the skin continues to be less creased with movement and the lines become less prominent. A neurotoxin like Botox takes about 3 days to take effect, and full effects are seen in about 2 weeks. I routinely see my patients at that time to evaluate the results and see if any enhancement is needed. The effect of Botox or any neurotoxin decreases over several months, so patients come in on an average of about every 4 months. Vertical lip lines can also be due to volume loss of fat and soft tissue beneath the skin. Volume loss due to aging causes loss of projection above the lip, resulting in lines and creases to be more visible. By placing a hyaluronic acid filler like Restylane or Juvederm for a volumizing effect, the skin is lifted slightly, making the lines and creases appear more smooth. Filler application can be performed in a few minutes and can last between 6 and 12 months. Vertical lip lines can also be caused by diminishing skin quality. The skin can lose collagen and elasticity due to aging. To stimulate collagen and tighten the skin, treatment like laser resurfacing or radiofrequency heating can be employed to induce a controlled injury response. The body reacts to this controlled injury by producing collagen to heal this area. The collagen response can also help smoothen skin and thereby improve the vertical lip lines. The nasolabial folds or parentheses lines appear to deepen due to volume loss associated with aging. The nasolabial folds can be improved indirectly by adding volume to the cheek as well as to the mid-face. I add volume to these areas using a technique called structural volumizing, also called the Y-lift, where thicker hyaluronic acid fillers are placed at the bone level, which is below the muscle layer. This method restores volume where volume loss is most significant, which is at the bone level. Unlike commonly practiced filler placement, which is just below the skin, deeper placement prevents filler from shifting, thereby avoiding the doughy, less youthful appearance seen commonly with traditional filler placement techniques. In addition, this structural volumizing technique also has a lifting effect that further softens the appearance of the nasolabial folds. This structural volumizing technique came naturally to me as a surgeon with extensive experience in performing facial implant surgery and facial fracture repair. So instead of placing silicone implants on top of the bone, I place long-lasting injectable fillers. Using thicker hyaluronic acid fillers like Juvederm Ultra Plus and Juvederm Voluma, the results of this procedure can last 1 to 2 years. The lines and folds that start at the corners of the mouth and go downward are called mesolabial folds, also known as marionette lines. These folds are also due to volume loss caused by aging and are often treated at the same time as nasolabial folds. We treat these lines with hyaluronic acid fillers like Juvederm Ultra Plus and Juvederm Voluma. One particular advantage of hyaluronic acid fillers is the ease of reversal. That is, they can be dissolved with the enzyme hyaluronidase if someone is dissatisfied with their results. This is an important differentiation because for this area we can also consider a filler like Radiesse, which is made up of calcium hydroxyapatite, a material similar to bone, which is also a long-lasting filler. However, Radiesse cannot be dissolved. We further address the mesolabial fold by adding volume and contour to the jawline, also at the bone level with structural volumizing. The jawline up to the chin tends to lose its continual contour and definition with age, and this can also affect the appearance of the mouth. By adding filler to the jawline all the way to the chin to make the contour more continuous and defined, the volume correction can also improve the appearance of mesolabial folds. These filler treatments take minutes to perform and patients can see improvement immediately. There may be a little temporary swelling after treatment, but this is generally minimal and resolves quickly. I regularly see cosmetic filler patients 2 weeks after treatment to see how the filler has settled and if any additional enhancement is needed. Patients can even have this type of treatment done shortly before an important event, like a wedding. In my opinion, filler placement is to be treated as seriously as surgery. Once you've entered below the skin, in my mind, the procedure is invasive. Fillers are often applied by non-physicians and doctors who don't perform surgery. As I mentioned earlier, I feel that my experience as a surgeon has been very useful in how I place fillers, particularly at the bone level, allowing my patients to have consistently satisfying outcomes with minimal swelling and rarely experiencing any bruising. I hope you found this information helpful. Thank you for your question.